A student asked me, "What is mental illness?" I want to thank Maryennys for bringing this question to my attention. What is mental illness? When we think about mental illness, so I prefer to say mental health challenges, we want to imagine or depict an interplay. If you could close your eyes just for a second and see you're sitting calmly somewhere, and within you, you have a system of genes, energy, different things going on outside of yourself from the environment. We have stressors, things that might trigger our genetic predispositions or vulnerabilities. When I was lecturing at a college, I used this demonstration that I'm going to use now of a light switch where our genetic predispositions to mental health challenges could be dormant. They're not awake, they're asleep, resting. And then something happens in life to switch our genes on. And we think of this switch being a response to information that we're receiving from external sources, in addition to how our genes responds to that information. And our responses when we are children, and we're responding in ways to protect ourselves. Some of us, if we experience trauma, we try to imagine that we're not experiencing it. We disassociate from it. We use our imagination to escape. Some of us fight back. Some of us freeze. However, we're responding when we were children, we start to experience frustration when these responses are no longer working. And so when we're talking about mental health challenges, we want to see these, at least clinicians, they look at it as in clusters of symptoms. So not just, you notice you have one symptom, you maybe you get angry really easily. You find yourself going from 0 to 100 like that, right? So that's just one symptom. We have to really study the whole person, their culture, their experiences, their strengths, their vulnerabilities to really understand how they are responding. And the point of seeking an understanding of if you have mental health challenges, is to really learn how to adjust to life in your most effective way, right? And also recognizing that your adjustments to life, how you are growing and you know prospering in different areas of your life, whether it's your relationships, right? If you're having peaceful, tranquil, drama free relationships or minimal drama, you're able to convey your thoughts and your feelings and feel heard, feel understood. You're able to have empathy to recognize the emotions of others as well as within yourself, right? You're able to negotiate for your wants and needs and to respect the boundaries of others, right? All of these are assessed across different disorders and across a continuum of the person's entire life, right? And so we have different types of mental illnesses ranging from birth all the way to adulthood. Now, when we're talking about this stress that's significant, we're looking at thoughts, distress and thoughts. Sometimes, and depending on the disorder, people feel that they're experiencing, they discuss experiencing intrusive thoughts of, wanting to harm themselves, thinking life would be better if I was not here. Of course, if you are experiencing that, please, I'll leave a link below for you to reach out to the suicide Hotlines. I would leave that link below. So we have the sorts. Some people experience hearing and seeing things that other people cannot hear or see, right? Others lose, their ability to focus. They lose their ability to attend to things, to recall things. Right now, next we're looking at emotional regulation. With regard to emotional regulation, it's sometimes, clients express feeling a lot of emotions happening at once, right? Where they're happy, all of a sudden they're crying for certain periods of time. They're not quite sure why they're crying, what triggered the crying. So you could imagine just experiencing that and not being able to focus on tasks that you would like to get done because you're you're being distracted or preoccupied with strong emotions, right? And finally, we're looking at the behavior, right? So the thoughts, when we're looking at the science of cognitive behavioral therapy, we discuss how our thoughts impact how we feel, and how we feel impacts what we do, and we find ourselves either stuck in a destructive pattern of behavior where we really start experiencing the stress to at levels where we may even lose our jobs, or we may lose relationships that were important to us, right? And or we also, as a whole person, we have maladaptive ways of coping, but we also have adaptive ways of coping. Right? So, the trend in therapy now is really not just obsessing over people's, trauma and the stress and, maladaptive behaviors, but really honing in as well on their strengths, on their resourcefulness, on how they could leverage their assets, so to say, to balance off and to even learn how to respond more effectively with regard to maladaptive responses and adjustments to life. Now, when we think again of mental illness and mental health challenges, remember that they occur across a continuum. They can happen to absolutely anybody. And in terms of the statistics for America, 1 in 5 people report are reported to having a mental illness. Okay, so that brings us to the end of what is a mental illness? A cluster of disorders that cause significant distress across the continuum of our experiences. We may have had genetic predispositions to these disorders. However, the environment plays a key role in switching those genes on. I'm going to leave information for anyone who feels, they've had pressured, thoughts, intrusive thoughts that they're feeling as though they want to commit suicide. I'm going to leave links in the description below. That brings us to the end of our presentation today on what is mental illness. Thank you for watching. Again, thank you, Maryennys, for posing this question. Have a great week, everyone.